This week, we're going to be talking about best methods for stretching and if you should be stretching, and just get some clarity on the best way to stretch your muscles. There's four major categories of stretching. There's static stretching, which is just holding a pose. You're not really moving. There's dynamic stretching, which involves movement through a stretch. There is active stretching, which is usually dynamic. So dynamic stretching is active because it involves movement. The term active actually refers to the muscle that is being stretched being active. So that muscle is activated or contracting in the stretch. So you can have a static stretch, one that does not involve movement, but have that static stretch also be active. So you're not moving, but you can be activating the muscle or contracting or engaging that muscle while it's being stretched. And that is a very effective method for stretching as well. And this is what I believe is the most important factor in any stretch, is that it's an active stretch. And so that leaves the fourth and final major category of stretching, which is passive stretching. And passive stretching is going to be static. It's not going to really involve movement, and it's not going to involve the contraction or the use of the muscle that you're stretching while in the stretch. So let's talk about why active stretching in particular, dynamic and active stretching, why are they preferable over passive stretching? If we look at muscles as not just these passive tissues that are like rubber bands that lengthen and contract, that are just tissues, but we think of them as that they're actually alive. They have electricity flowing through them. And so they're biological tissues, and the electricity is actually communicating to them and teaching them how to be, how to hold tension, how to release tension, constantly giving and receiving information to the brain about what is safe for the muscle to do and what's not safe for the muscle to do. If we think about muscles that way, then it is absolutely necessary to include the neuro part of the neuromuscular system, the nerves, in anything that we're trying to train a muscle to do. So stretching, we can assume the goal is to train a muscle to lengthen. And if we just do passive static stretching, which I will demonstrate, we're not involving that neuromuscular system. So we're just stretching it out like a rubber band. And then when you're done with the stretch, it's just going to return back. And no training has happened to the headquarters, to the software program. But when we include the nerves, then the training registers in the software program. And the way that we involve the nerves is through activation or contraction of the muscles. I'm going to show you passive and static stretching, and this is specifically for the hamstrings. So this is classic, just touch your toes, really not doing much, just passively hanging. This is the type of stretch that's just going to take the elasticity out of the muscle. It's like stretching a rubber band, and then when you're done with the stretch, it's going to just return back to its original length. No real changes have taken place, no long-term changes, and no training to the motherboard to teach your neuromuscular system that it's actually safe and functional in this new lengthened range. So now we're going to move forward. This is another type of common, like just passive stretch that people do. Put your leg up, maybe grab onto your leg or grab onto something and just pull yourself forward with your arms. You know, it's active in the sense that maybe you're using your arms to pull yourself forward, but those are using your arm muscles. What we want to be including in the stretch is the actual muscle that is being stretched is the one that needs to be active or engaged so that that muscle learns how to function in this new lengthened range. So let's show some examples of active stretching that is dynamic. So this is going to involve movements. I'm stretching my hamstrings, but I'm moving them and using them through the lengthened range. Here's a standing version of it. I'm moving, using my hamstring. And here's another just dynamic active stretch, just yoga, where you're kind of doing movement through poses, is a good form of active and dynamic stretching. So now let's show that kind of in between the overlap that I talked about. So this is a static stretch, doesn't involve movement, but it is active because I'm going to be engaging the muscle in the stretch. Even though it's not moving, it's kind of an isometric engagement. And the common name for this is contract relax stretching. There is also a very complicated name in physical therapy called proprioceptive neuromuscular facilitation. You don't need to know that, but if you ever hear PNF stretching, it usually involves another person, like a therapist, that's going to coach you and facilitate you through this process of contract relax. It's a very effective way to get more length out of a muscle. So I'm stretching my hamstring on the chair, but I'm also pushing my foot down into the chair while stretching it, which is going to engage the hamstring muscle and teach it to function in this new length. There's a little bit of an uncomfortable feeling sometimes, because when you engage a muscle, you're actually you're attempting to shorten the muscle, but you're doing it in a lengthened position. So it's new territory for a muscle to engage in. But it's a very healthy way to train muscles to learn how to function in a new lengthened range where they may not have been comfortable or, may not have felt safe to engage prior. And that's why they didn't allow themselves to go there. They don't allow themselves to go into ranges that they feel vulnerable in. Muscles don't feel safe because they might strain or they might tear because they're not trained in that new range. So this is the main message I want to bring home with you guys. And so here's a different muscle group. So we're going to do hip flexors. We'll go through this a little more quickly. Passive, static stretching of the hip flexors. I'm just doing the kneeling hip flexor stretch. Now we're going to switch it to an active stretch. We're going to engage the muscle. Now I'm pushing my knee into the ground. This is what we do in core balance training, the kneeling hip flexor push away. So we're engaging that muscle, teaching it how to function in that new range. And the end result is ultimately that the muscle is going to be more likely to maintain this new lengthened range because it feels safe and has learned how to function in this range. So here's more hip flexors, active and dynamic now. So we will just add some movement. We're lengthening and shortening the hip flexors, using those muscles to while lengthening them. So this is just the dynamic version of that stretch. So for somebody with SI joint instability, I would not recommend the kneeling hip flexor stretch or any kind of one-sided hip flexor stretch because that is going to torque the SI joint because you're only stretching one half of the pelvis. It's going to create a torque on the pelvis. It's going to do this to the pelvis. One side is going to get stretched forward. The other side's going to have opposite direction force. And so all of that torque will go into the SI joint, which is in between those torques. Core balance training uses the bridge as one of its most effective tools for reversing chronic lower back pain. So we can tie it into this lesson and just talk about how the bridge is an active stretch of the hip flexors because we are engaging all of the muscles around our pelvis and our core and our legs is a very active stretch. And it is simultaneously lengthening the hip flexor muscle group and particularly this rectus femoris muscle, which is a very difficult muscle to stretch, especially actively. This is one of the only active stretches of this muscle, exercises that actively stretches this muscle that I know of. This is one of the ways that it ties in. It's lengthening the rectus femoris over the hips and the knees and simultaneously engaging all the muscles around the body, which is training the body to be able to feel safe and keep that muscle group in a more lengthened state. So it's no longer yanking on your lumbar spine, causing chronic lower back pain. Even hamstring stretching, which I was doing in the demonstration, it's not something that I think is going to be a huge factor in getting out of back pain. It can feel good. It feels good to move your body, but having lengthened hamstrings is not necessarily required to get out of back pain. What you will need is lengthened hip flexors, and you need strong and stable glutes and core, deep core muscles. And the hamstrings kind of help the glutes. So I don't have a huge problem with tight hamstrings. So this is just to apply to whatever stretching that you choose to do, whether you're doing it in the program or outside the program, to get the most out of your stretching. Main message is, if you want your stretching to be worthwhile, if you want your stretching to be effective and have a better chance of lasting or having a prolonged effect, so that maybe tomorrow your muscles will actually have maintained a little bit of that extra length and stretch that you're trying to put into it, make sure you're contracting or engaging the muscle in that stretch. That's called active stretching. And so dynamic stretching is a good way to accomplish that, but it doesn't have to involve movement, because like we talked about, we have that contract, relax technique, which is very effective, and it does kind of hack the neuromuscular system to be able to gain length quickly in a muscle. So best done initially under supervision, but you can just practice contracting and relaxing a muscle while in a static stretch, and that will have a similar effect. Until next time, guys, make sure to get down on the floor and connect to your core.